What's up, Rai? Welcome to science class. As a student of science, I wanted to take flavor every branch of science. What kind of things they do, that is bad, that is lesson, that is good, or that is not. As a Muslim, we are the one and only creator except Allah, Allah, Krishna, last and best mention. Now, those are my patient and parents out there. You have depression or anything wrong, you know that your activity is not usually normal. Those have, they are fear about that, they have they have psychological problem. You see me, when I failed the exam, medical exam, Dr. Momo Chudhuri, when failed the exam, what happened? Depression come. From that, you know that, see that, automatically talk and answer, laugh, sorrow, laugh, also cry. Everybody said that the diagnosis, my diagnosis in case of my professor, Holy Family Red Crescent medical professor, Nazmul sir, and Farjana Rabin madam, under treatment, and Deloa sir. And before go to the treatment, I say my small brother Shami, you see that, they say that. I give choke tip, they say that. But automatically, in case of pair time, I also laugh, cry, also talk. In case of in my pair time, I also read and write about one and only creator, also creation. I utilize my time. So those have sorrowness like me. Failure is the pillar of success. Also they need counseling. Today's topics represent counseling. How you remain and remain happy. In case of B, say psychopath, mad soil, psychopathic soil, I have no headache. At the end of the day, I I do any criminalism with other, and I hurt harm me. Also my, those are necessary. You hurt harm, you cut your body or try heart, no. You see that my hand and everything is normal. Now I not hurt me. In case of depression, either bipolar, they diagnose it as a bipolar mood disorder, then schizoaffective disorder, schizophrenia. Schizoaffective disorder, schizophrenia. Now my parents, I know that the treatment. In case of schizoaffective disorder, now I close that. It I close that video. You say what say? What is say? What say? That is mad, psychopath. But when I see that Bluetooth, you say, oh, talk with, talk with here or talk with other. That is the solution. That is the treatment as by I give it for me, my A to Z version. Automatically, a question come about one and only creator also creation, and I try to solve that problem, and by my own capability, by utilize my brain, who is created by creator, and made by creator. I am also creation, you know that, forget. Sometimes I forget, you know that, when in that position, I have a bad habit in tea smoky. When I not got tea smoky, I also angry. Angriness come. That is the proof that I am also creation. But what I do, the known people, I go to there and take smoky and tea, cup of tea. When money come, I give them. I take from home equal more or less 1000 taka per day for my pocket money, for my pocket money. By that money, I I take smoky tea or other food. Those are patients suffer that depression, and you know that, uh, excitatory media is excitation and depression. Excitation, you know that, fight food, and excitation mode, you go to the angriness, go to the excitation mode, you go to the angriness mode, then fight food, fight other without negligible reason. And in case of depressed mood, you can hurt you. What is the reason depression come? In excitation come. Now we go to the for example, first knowledge. If fail the exam, failure is the pillar of success. Then knowledge, then woman. In case of me, I also got failure is the failure. I got Dr. Momo the complete MBA is good, 5 years course, equal more or less 10 years. Then woman, I have a lab. I was a lab. Dr. Momo was a lab vision that was broken. Then you see that knowledge, women, wealth. Dr. Mohammed Shoshudri, what my wealth? You know that I have no wealth except hot father live. Now wealth problem also I have. You then knowledge, power, wealth for understanding purpose. Knowledge, power, wealth, power. Knowledge, women, wealth, power. In case of Dr. Mohammed Shoshudri, one or two a leader, but I am not leader. Power also power reason. Now addiction. Dr. Momo Sudhir has an addiction like smoking is a very bad habit. Also cup of tea. Cup of tea I remove. Smoking is a very bad habit. Smoke. Now five problem I got. But what is the solution? Knowledge. Okay, failure is the pillar of success. Read and write. Pass the exam. And women. Okay, no problem. My woman leave me. My one and only creator Allah not leave me. After death, who is my couple, give that and prize. If I believe one and only creator, follow the rules regulation of one and only creator. And as a Muslim, La ilaha illallah Muhammadur Rasulullah, good work minus bad work, good work remain. Creator, give me prize by that work and forgive me. Now, women, wealth, problem solved. Women, knowledge, women, problem. Already passed the MBBS. Knowledge problem solved. Now, already you know that women problem, wife problem, already solved. Now, wealth. How much wealth my father leave? You know that what my eyes talked with my father and sister. In justice, I get, they give them more than that. Enough, more than enough. Now, women, knowledge, power, knowledge, women, wealth, problem solved. Now pocket money. I see the patient not if anyone give cordially, royalty taken, otherwise not. Then money problem also solved. Now you know that women, wealth, women, knowledge, women, wealth. Now wine. Normal knowledge, women, wealth. Now wine or addiction problem. I have a smoking. I try to control, but not control. Equal more or less 20 stick per day. Addiction, but by addicted I not harm me or harm other. Control. Now knowledge, women, wealth, wine, power. Power I wanna be leader, but I am not go to the election. No need. As a doctor I feel better. No need election. If I go to the election and lost the election, I have the depress or angriness, harm other. And try to that. Those are my pen supporter. You have, if you have then, and now you have the, you say that I have no job, but in case of I own capability, I give lecture in Google, Facebook, Instagram, TikTok. In case of Google, $10, YouTube, Google per minute $10, royalty, YouTube $9, Facebook, Instagram, Facebook $8, Instagram $7, TikTok $6, equal more or less. For example, they, if anyone not give the money, no problem. See that. If see that I earn neki after death, creator give me price. That is my work. Fine. No need go to the other job. And as a doctor, if those are patient, those patient believe me as a doctor, come, I see them, and they cordially hot money given. By that money, I go. For example, I go to the village, only 200 taka given. I take that cordially, not corruption, not greedy, not by force. Try to understand that. I feel shy and shame about that. Understand? I think better understand. Now those are depressed. And now medical science. There is the excitatory, inhibitory neurotransmitter. Excitatory neurotransmitter excited you, and inhibitory neurotransmitter inhibit you. If excitatory neurotransmitter more like dopamine is more, then you go to the excitatory mode. Then what happen? Excitatory neurotransmitter, what is dopamine, and inhibitory GABA, serotonin, are acetylcholine, both excitatory inhibitory. Then imbalance, if in substation dopamine and acetylcholine in brain imbalance, if dopamine is more, then dopamine blocker given, then come in normal. If dopamine reduce, give the dopamine. Ure baapre baap. For example, purpose, for understanding purpose. If excitatory mood over, then given. If excitatory neurotransmitter more, then try to give them blocker. If inhibitory more, then patient go to the depress. Give the excitatory or block the inhibitory. Just like that, for simple of psychologist or psychology field. That is the typical typical antipsychotic drug. Typical antipsychotics are atypical antipsychotic drugs. Some drug, but in case of in case of psychotherapy, that is necessary. Counseling is more important. For example, if I wait for that woman, who leave me, what happened? Already married, children. Why wait? If my couple, I got after death life. If if other couple, he got no problem. I have no headache. I enjoy that. And you know that what is the reason? If I if I if she is not my soulmate, I enjoy that. What is the reason? Okay, I already if my soulmate, I also enjoy. Okay, leave me, go to the other home, not break the home. That is also same. They cordially do that. No problem. After death life, Creator give me a prize. I remain good until death. And believe one and only Creator, follow the rules regulation of one and only Creator. La ilaha illallah Muhammadur Rasulullah. And in case of science class, that is the branch of science. What science? Medical science. And medical science branch of psychology. You know that? Sometimes I forget. You know that when go to the tea shop, anything. Dear, how I correct that? I see the pocket money. Now utilize how much money I got. I how much I have how much money in my pocket, zero money, already 10 taka. Then I give to the tea shop, one cake remained, one cup of tea. Now 10 taka, 5 taka. Now what money remain? I say zero money, not zero money, 5 taka remain. Now I go to my pocket. Where is the 5 taka? Where gone the 5? Now forgot the 5. I forget. That is 5 taka coin. Now I solve that problem by that policy. That is the psychology. Psychology and speciesology. PSYCHO. Psychology. LOGY. Speciesology. PSO for spelling of psychology. PSY. PHOY. See the book. PSY psychology. Cholo psycho CHOLO psychology. See the meaning. I also forget that. You know that psychology. In the psychological field. You know that, understand that. Now short term memory loss. If you say short term memory loss, forget everything. Remind one thing. Allah is the one and only Creator except Allah. All are creation. Last time best messenger Muhammad. Those are Muslim. What Allah say by Quran was what not to do. Then what to do you do by your capability. What job or what work you know. Do that, earn what money, fulfill your basic need, and as usually you try to do your normal activity. Those are suffer that depression mood or excitatory mood. Then go to the doctor for counseling. Then in case of doctor, give emphasis in counseling. Then drug. In case of drug, who is patient take drug? You see the pulse remain normal, breath rate remain normal, not heart. There is no sign of heart body. There is not sign of heart other creation. That patient can be cured by counseling. No need drug. Understand? I think better understand. Also pulse rate normal, vital sign like pulse, breath rate, respiratory rate. তারপরে in case of bowel sound, in case of bowel movement, also urination, also stool, evacuation, everything is normal. This patient, those are my patient, don't worry, you have no need drug. You can easily. What is the solution? Fail the exam, try to pass the exam by quality, quantity, causation. Fail, leave the woman, no problem. woman leave, creator not leave you. And if you couple, you you will get him after death life. Wait for that. If you not wait, then go to the marriage. If you not soulmate, you are enjoy that. There she is not my soulmate, but I already do something. Something is better than nothing. One and only kid to forgive. Not break his, not break her house. Understand, that is also said. Now, woman knowledge, woman wealth. In case of wealth, how much wealth you have? Cordially, in case of your father, mother, say to the father, mother, brother, and just from that you take pocket money, how much pocket money you got, and that you do normal activity, and hot food you need, like eat that, hot drinks, just like that. Those are knowledge, power, woman, wealth, wine. Those are addicted. I say to father, mother, give addiction to home, reduce, and monthly reduce. If not reduce, no problem. By that addicted, if he or she not hurt his or her or other, no problem, continue that. And in that situation, if those are addicted, see your pulse remain normal or not, breath rate, anything normal occur or not. If pulse remain normal, breath rate remain normal,